Hello Medicos, welcome back to our channel Learning Medicos. Let's keep learning and rise up together. I'm your host Prashant Sharma and let's continue the discussion of our topic of cranial nerves. In the previous video, we have discussed about the cranial nerves origin and attachment to the CNS. In today's video, let's discuss about their passage through the different foramina. So first cranial nerve, which is olfactory nerve. It passes through the cribriform plate. Cribriform plate is a sieve-like structure between the anterior cranial fossa and the nasal cavity. This cribriform plate is a part of ethmoid bone and it supports the olfactory bulb. Now what we are able to see is the sphenoid bone. Okay, this is the body of the sphenoid bone, lesser wing and greater wing of sphenoid. This is optic canal. We can see this optic canal in between the body of the sphenoid and the lesser wing of sphenoid. Through this optic canal, our optic nerve passes, which is a second cranial nerve. Now, this pointed out structure which we are able to see is called as superior orbital fissure. Okay, supraorbital fissure. It lies between the lesser wing and the greater wing of sphenoid. Through this, that is superior orbital fissure, passes our third cranial nerve, fourth cranial nerve, sixth cranial nerve, as well as the first division of the trigeminal nerve, that is the ophthalmic division. Now, as I said you, this is the greater wing of sphenoid. In the greater wing of sphenoid, we can see foramen rotundum, foramen ovale and foramen spinosum. Through our foramen rotundum, there passes our second division of the trigeminal nerve, that is the maxillary division. This foramen rotundum is a circular hole in the sphenoid bone. It connects the middle cranial fossa and the pterygopalatine fossa. Foramen ovale. Through the foramen ovale, our third division of the trigeminal nerve, that is the mandibular division, passes through it. This foramen ovale is situated in the posterior part of the sphenoid bone, posterior lateral to the foramen rotundum. It is an opening in the greater wing of sphenoid. Our seventh and eighth cranial nerve. These two cranial nerves, they passes through the internal acoustic meatus. Our internal acoustic meatus is also known as internal auditory canal or internal auditory meatus. It lies within the petrous part of the temporal bone of the skull between the posterior cranial fossa and the inner ear. If you also remember, labyrinthine artery also passes through this internal acoustic meatus. Our 9, 10 and 11 cranial nerves, they passes through the jugular foramen. See, here is the jugular foramen. This jugular foramen is a large opening in the base of the skull located behind the carotid canal. It is formed in front by the petrous portion of the temporal bone and behind by the occipital bone. Our 12th cranial nerve, that is our hypoglossal nerve, it passes through the hypoglossal canal. See, our hypoglossal canal is situated here. It is a foramen in the occipital bone. So let's overview once all the cranial nerves and their passes through different foramina. Our first cranial nerve, olfactory nerve, it passes through the cribriform plate. Our second cranial nerve, optic nerve, passes through the optic canal. Our third cranial nerve, fourth cranial nerve, sixth cranial nerve, and first division of the trigeminal nerve passes through the superior orbital fissure. Second division of the trigeminal nerve through the foramen rotundum. Third division through the foramen ovale. Our 7th and 8th cranial nerve passes through the internal auditory meatus, 9, 10 and 11 through jugular foramen, and finally the 12th through the hypoglossal canal. My dear medicos, In this video, I have focused only on the cranial nerves and their passes through different foramina. But to be frank, through the same foramina, even the other arteries, nerves and other structures also do pass through them. My dear medicos, in this video, I have focused only on the cranial nerves and their passes through different foramen. But to be frank, even other structures also do pass through the same foramina. If you want to know what are those structures, please check out the description. I have provided you with the mnemonics to remember all those structures. If you find our video interesting, please do like and share. Comments are always welcome. And do subscribe to our channel, Learning Medcos. Let's keep learning and rise up together for more such interesting videos. Thank you.